Early into the final year of his first term in office, Mayor Bill de Blasio tacitly acknowledged what could no longer be ignored. New York City, like much of the country, had a worsening problem of drug overdoses from heroin and opioids, and the city's response had been inadequate. Overdose deaths surged to 1,374 in 2016, the majority from opioids, despite a comprehensive effort introduced the year before, when there had been 937 overdoses. The city's plan had focused on increasing the availability of naloxone, the opioid overdose reversal medication. Last year, Mr. de Blasio sharply increased the city's spending on its response to $38 million per year under its Healing NYC program, helping pay for treatment sites, more naloxone kits, and for former addicts to act as a kind of emergency response team after an overdose. The increased attention may have stemmed the tide. The police department has preliminarily attributed 924 deaths to opioid overdoses in 2017. Although that number is almost certain to rise as official death investigations conclude, the figure appeared to represent a leveling off after sharp increases the year before. How much the efforts by the city have helped is unclear. Some health and addiction professionals suggest that the city is apportioning too much of its money on police efforts, and not enough on extending treatment. Indeed, the police department is the single biggest beneficiary of the spending, $15 million a year for 84 detectives, mostly assigned to so-called heroin overdose teams. After an overdose, narcotics detectives begin by noting any distinguishing marks on the heroin packaging, such as a stamp on the glass sign bag, and poring over the cell phone records of the overdose victim to look for the source of the drugs. Usually it's the last one, or the last couple, the chief of detectives, Robert K. Boyce, said of the phone numbers, which are fed into a growing database of thousands of numbers that turned up at overdose scenes in 2,260 overdose investigations last year. The father of a 41-year-old Queens man who struggled with heroin addiction and died at his parents' home this month, said the officers who responded were respectful. "The police are trying to find out what's going on in the neighborhood," said the father, who asked not to be named. "We're trying to slow down this crisis," Chief Boyce said. In January, there were more than 60 deaths recorded by the police, who frequently see 3 in a day, a steep toll, but a slower pace than 2 years ago. "This is one day," Chief Boyce said, reviewing a stapled briefing paper from February 1 on which brief summaries of 7 overdoses appeared like those of any murder. One was found in his mother's house, another came first thing after sunrise. 4 were saved by emergency medical workers or police officers who administered naloxone. 3 died. Each resulted in a new case. Yet in public materials, City Hall has seemed to de-emphasize the role of the police. The mayor's 36-page, full-color pamphlet announcing the plan offered a 12-point strategy. Its new teams of detectives were listed as Strategy 11. "The stuff that they're putting out there, it's not anything bad, but it's incomplete," said Julia Dualt, Director of Community Engagement at Boom Health, a harm reduction nonprofit in the Bronx. "Why are we continuing to put most of the money to law enforcement?" She added that a health department report on so-called supervised injection facilities, funded by the city council over a year ago, had yet to be released. No such facilities, where heroin users can inject themselves under supervision to prevent overdoses, exist in the United States, though Philadelphia and other cities have moved to open them. Mr. de Blasio has so far demurred on his position, insisting the report would be made public soon. City officials acknowledged that opening even a single such center, where illicit drugs would be legally taken, in a given neighborhood could generate significant political pushback. If our city has record low crime but record high overdose deaths, can Mayor de Blasio really say that his allocation of funding is smart public policy? Asked Jeremy Saunders, the executive director of Vocal New York, a nonprofit coalition of community activists. There is only one logical answer: it is about politics. At the same time, in a small but growing number of emergency rooms, those who survive overdoses are being approached by friendly-faced former heroin or opioid addicts in royal blue health department jackets, part of a $4.3 million pilot program called Relay that began in May. The approach, modeled on one in Rhode Island, is akin to one used in crime-prone neighborhoods, with former gang members seeking to intervene to head off violence before it begins. Robert Fagan, 48, whose father fatally overdosed when he was 15, began using heroin in the 1990s and later spent years in and out of treatment before he finally got clean. That experience informs his approach to the addicts he helps, with everything from a ride to a detox center to assistance with paperwork for Medicaid. He is one of 10 such peer outreach workers in 5 hospitals. The mayor has vowed to double the number of hospitals with Relay workers by the end of next year. Other promises have been slower to get off the ground. Most, but not all, city-run primary care clinics can prescribe buprenorphine, a maintenance drug, despite a vow to extend the offering to all such health and hospital sites last year. A goal to establish site buprenorphine treatment at 7 syringe exchange programs in 2017 has yet to be met. 4 will start prescribing by June, another 3 will start the following fiscal year. The delay, according to Olivia LaPairolari, a mayoral spokeswoman, is because of training requirements and the necessity of a state waiver to prescribe the drug. Nonetheless, New York City is better than most cities in its array of treatment facilities, a legacy of the first heroin epidemic, said Dr. Hillary Cunins, an assistant commissioner at the health department. Unlike many other parts of the country, we actually have available treatment. The city, with an estimated population of 60,000 to 80,000 heroin and opioid addicts, is likely to be funding such treatment for years if not decades, she said. Mr. Fagan, for his part, has helped 29 people since he started work in the spring, including a homeless man whom Mr. Fagan has already encountered twice in the emergency room after an overdose. After the second time, the man accepted his help, which includes a care bag with a round-trip Metro card and information about fentanyl, a potent opioid blamed for the recent surge in overdoses. Overall, since May, about 155 people accepted counseling from peers like Mr. Fagan. A smaller number accepted referrals for treatment or other services. I say I have lived experience with using drugs, Mr. Fagan said, explaining how he introduces himself to skeptical patients, who are often in the throes of a withdrawal in the emergency room. Once you say that, a lot of barriers come down.